I developed a set of instruments that were made for implants and different facets of implants, but every implant instrument that exists is a copy of an instrument that was designed for teeth. Hygienists are always struggling and dentists are always struggling on what instrument to use, and there's no silver bullet. Well,
right.
I think we came up with a silver bullet
Great.
around implants. The goal of them is to get underneath the prosthesis, in between the gum and the prosthesis, in order to clean.
Right.
If you do that with any other hygiene instrument, the patient is going to say, ow. The first instrument is called the Pineyro Arch 1. It's made to fit around the abutments and the framework and kind of lock in place.
So great.
So you don't even have to look. As long as you know where the screw hole is,
yes.
you can go under the tissues and you can lock in place, and then you can start cleaning that area. The Pineyro Arch 2, once you've done all the interior, upper and lower, you go to the Pineyro Arch 2, and the Pineyro Arch 2 is made for posterior. So you do all the posterior, left, right, upper, left, right, lower, and then you put that down. Then you go to the Pineyro Arch 3, which was made for mesial and distal or hard to reach areas. It's just a separate angulation, and then you can get into those areas that you think you didn't clean effectively enough the first time with the other two instruments.
Right.
And the Pineyro Arch 4 is a completely different shape, but it's flat and it can get you underneath tissues in between prosthesis. And this is especially good for cantilever areas. When we have these full arch restorations, we have cantilevers, and you're able to get in between the tissue and underneath to reach under that. With any other instrument, you can't get there.
Check out all our great PDT products and specials at pdtdental.com.